the talk. We have read your paper. We've highlighted everything. Okay, so I think one of the things that where was it? The concept of humanness. I think, and I like how you defined technology as making things more efficient. I think as a nurse, or as a human being, the first thing we think about technology is electronics of some sort, gadgets, computer, and I think people, the way you presented it, it changes the viewpoint of what technology is, and as nursing, in regards to our practice implications as to how to care for someone and not losing that concept of humanness. And I guess the good thing about that as well, it sort of matches up with the organization that Jerome has started, which is Nursing for Humanity. So it actually matches up pretty well. So Brian, we were before the seminar, we were talking about technology, and I think Brian. So I think one of the things we'd like to focus on for the meantime is, how does this? What are the nursing implications of technology? So I think Brian wants to share a few things. Yeah.
Thank you for the very good talk, sir. The first thing that pops into my mind after hearing this talk was the movie Baymax. You probably have seen it all. It's an animation movie. It's like a humanoid sort of like bubble thingy, that health assistant or help, whatever he calling himself up. So, at the other end of the spectrum, the human being asked by so many questions, which is all algorithm, it annoys them. Really annoys. I'm not sick. I'm not. You're feeling anxious. I'm not anxious. Blah blah blah. So you're losing that mutual. You're trying to set a mutual understanding with this person, but you're cutting it off from the start. Here in Australia, we've got this ad, which is from a bank. This customer walks in, walks into like humanoid robots, that who greets him. He went to another bank, similar thing experience. Now he was so grateful, like on the last bank he went through, was a real human who can understand him, who can sort of like, touch him emotionally.
Right.
So that's a very good spectrum of how human understanding should, take place. Nowadays with technology, as a clinician, working in hospitals and all that, it's really hard for nurses to sort of adapt with technology. Especially in Australia, we're kind of late with technology in here. But Intel has this very good campaign at the moment, which I have read, like putting some wearable gadgets to people, which would sort of like specifically help them in community, like special community nurses. One can wear some sort of like a Fitbit tracker, which would monitor patients' heart rate, temperature, and all the vitals and all that. If, for example, this patient was just sent home post-operatively, and this nurse sort of like obviously tracked the temperature was rising, obviously this nurse in the community can sort of attend quickly to this patient. Imagine patient are in like a network, in a web, sort of connected to one community nurse, which can really help them sort of like broaden their healthcare and broaden their services and all that. Well, humanoids or humaners can be the future. I mean, sort of human robotic nurses can be the future, which could eliminate us clinicians working in hospitals.
Especially Filipino nurses.
Yes.
Limits the
The thing is, it would take away some opportunities. It would take away our occupation.
That's right.
But it would add some more occupation to us as well. Like, who's going to be looking after some complex sort of issues with regards to these robots, nurses, and dreamers? Seems to be very futuristic there, sir.
Yeah.